Looking at the model of the upper limb, this is the medial side because this is scapula going towards the hand. This is the thumb, so the lateral side, and the little finger, which will form the medial side of the arm. There we can see the clavicle. Alright, so if we look at the anterior aspect, we have this large muscle that is going to come from the clavicle and the scapula and is going to move towards the humerus. We can also visualize a nipple over here, which has not been dissected over here. So this is pectoralis major, which is going to go towards the lateral lip of the intertubercular sulcus. Below the pectoralis major, we have this mass of brachial plexus and the axillary artery and nerves. We can see the two heads of the biceps brachii. This one is going to be the long head of biceps. This one, which is going to come from the coracoid process over here. This is the coracoid process. So coming from that is the short head, and coming from the intertubercular sulcus, passing through the intertubercular sulcus from the supraglenoid notch, this is the long head of biceps, so the biceps brachia. Resecting the biceps or making it a little bit farther, this is coracobrachialis. They are almost joined in this specimen. So this is coracobrachialis, and this coracobrachialis is pierced by this nerve. Over here we can see this nerve that is piercing the coracobrachialis. This is the musculocutaneous nerve that is going to be present between the biceps and the brachialis over here. This is the musculocutaneous nerve present like this. Okay, moving onwards, we have latissimus dorsi and the subscapularis. Okay, if we the posterior side is covered by the skin, so we it is not dissected. Over here we can see very clearly a thrombosed vein, a thick walled artery, and some lymph nodes. So these are the lymph nodes, and they have been resected. So the lymph nodes that are around the axillary lymph nodes, they are present over here. Okay, so this is the axillary vein, this is the axillary artery with the lumen open. We follow them downwards. This is the axillary vein, and over here when they go towards the arm, they are called brachial artery and vein. So this is the brachial vein after it crosses the inferior margin of the teres major, and this over here is the axillary artery, and we can see the vena comitanthes around it as well, and they are also thrombosed in this specimen. Moving onwards, the nerve that is going to be crossing the cubital fossa is the median nerve. This is the median nerve. If we trace it upwards, the two roots of the median nerve are visible. Tracing it upwards, the two roots of the median nerve, this is the median nerve, and the two roots are visible. This is the lateral root, which is giving rise to the musculocutaneous nerve as well. The lateral cord, which is giving rise to the musculocutaneous, and this one, the median continuation, this is going to form the ulnar nerve. Tracing the brachial plexus deeply, this is the radial nerve, which is going to go and groove the posterior surface, going to be present in the radial groove. This is the radial nerve. Going towards the arm, the pronator teres is not visible over here. This is the medial side with the little finger. This is the lateral side with the thumb. So on the medial side, the pronator teres is not visible. So after the pronator teres, we have the flexor carpi radialis, this one, which is going to flex and abduct the wrist. Then we have flexor digitorum superficialis, this mass of muscle going towards the fingers, and over here we can see that the tendons of the flexor digitorum superficialis, they split to accommodate the tendon of the flexor digitorum profundus. This central tendon is of flexor digitorum profundus, and this one is the flexor digitorum superficialis. The superficialis attaches to the middle phalanx, and the digitorum profundus attaches to the distal phalanx. Okay, below them. And how can we identify over here? We look at the attachment. So looking deeply, we have two muscles. This one, the larger mass and present medially, is the flexor digitorum profundus. This one, smaller mass, is the flexor pollicis longus. So this is towards the radius. This is flexor pollicis longus. This larger mass is flexor digitorum profundus. And over here, this is the arterial supply, the anterior tibial artery, and these transverse fibers are of quadratus these transverse fibers are of pronator quadratus. This one is the pronator quadratus, and the anterior tibial artery nerve. Okay, towards the extensor, under the cover of extensor carpi ulnaris, this is the ulnar nerve, and this is the ulnar artery. This was the flexor carpi ulnaris. Okay, going towards the extensor surface extensors, we have the first three extensors, the brachioradialis, extensor carpi radialis longus, which goes towards the second metacarpal, and extensor carpi radialis brevis, that goes towards the third metacarpal. The outcropping muscles, the abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. And the radial arteries, we can feel the pulse of the radial artery over here, and then it crosses towards the anatomical snuff box. Posteriorly, we have this extensor digitorum longus, extensor digiti minimi, and then this muscle, which is the extensor carpi radialis.